John?
Yes, thank you, Mayor. Again, members of the media, please use the hand raise feature so I know how to know to call on you. They have a question, and also letting you know we have Director Deb Swanson from Grand Forks Public Health and Todd Phelan, Grand Forks City Administrator, available for questions as well. First question will come from KNOX Radio.
This question is for Senator Cramer. Senator Cramer, earlier today it was announced through the markets that China is well behind on what they're supposed to purchase from the United States in regard to agricultural products as part of the trade deal that was worked out. They're also responsible for this virus spreading around the globe. It's killed 100,000, or rather 90,000 people in the United States. They're not buying our ag products. They're responsible for this virus. When can we expect a response to China and their responsibility for this? And what do you believe that response should be?
Yeah, that's a great question. It's a complicated question. Obviously, China not only are they a communist country that has been far less than transparent and bears much of the responsibility, as you noted, for the spread of this awful disease. And the spread definitely could have been contained had China and the World Health Organization been much more transparent. So you have that on the one hand. But on the other hand, you also have a country, 1.5 billion people who eat 3 times a day and buy a lot of and like a lot of the products that we grow. And so it is a bit of a challenge, to say the least. I think that clearly the patience with China among the American public, as well as the leadership of our country, is wearing very thin. And every now and then you see an occasional criticism of people who criticize China, but by and large, people are figuring out that these are not great allies or friends that we have, and that's just scratching the surface. I mean, when it comes to things like 5G, their theft of intellectual property, their build out of very sophisticated weapons systems, largely that they've stolen from us. The building of islands in the South China Sea. I mean, China is not an ally. They are clearly an adversary, and we have to always keep that in mind. That said, on the trade front, I think that more and more we have to respond to China by trying to find a way to do things without China. Clearly, there's an emphasis, and a lot of us are on bills to try to bring much of our supply chain home, especially for critical things like pharmaceuticals and the required ingredients for pharmaceuticals, protection equipment, or personal protection equipment, food supply. And we're seeing the vulnerabilities of all of that. And at the same time, they still they're trying to buy energy companies. Obviously, they'd like to take advantage of the fact that we have, low value to very high potential energy opportunities, and so they'd like to buy it all up. And I think we have to put our foot down and either not allow any of that or allow a lot less of it. But we also have to remember we have to be able to find something to replace China. That's a really big market, and this is why I think is just an absolute move of genius that President Trump befriended Prime Minister Modi of India. India, as you know, right next door in the neighborhood. I've gotten to know the Prime Minister fairly well, and certainly many of the diplomats from India and a lot of the Indian Americans here in the United States, and especially in North Dakota. Many of them, of course, are in our healthcare system. And they're an important ally. And the reason they're so important is not only because they're nearly 1.5 billion hungry people, but also because they're the world's largest democracy. And while they're not the kind of democracy, the type of self-governed, democracy that we are in the United States, they are far more like us than China. And they create a leverage point for us, as well as a big friendly market. So I've worked a lot on policy related specifically to India, to Indian Americans, and some of the pulse crops and the things that we grow are in high demand in India. Now they also grow a lot of them themselves. So we need to, on the one hand, make sure that we diminish our reliance on China, whether it's for money, whether it's for cheap stuff, or for market share. But at the same time, we need to be looking for new partners to step into that. And I think India is a real logical, large choice, as well as, of course, several others.
Thank you, Senator. Next question from Neil Carlson at iNews. Go ahead, Neil.
My question's for Deb Swanson. Sorry, I got here late. I'm not sure if you covered any of this, but
Do you have any information about any possible COVID flare-ups at Simplot or any other facilities around the county?
Hi, Neil. I don't have any information about any clusters of cases, but certainly if we do determine that there are as a result of contact tracing, we would absolutely explore those.
Thank you, Deb. Next question from Joe Bowen at the Grand Forks Herald.
Yeah, basically same question for Deb, except we have heard a rumor that an employee or two at Target in town here, I want to stress it's a rumor for anybody listening, but we heard a rumor that a couple of them have tested positive. Is that the case?
I don't have any information to suggest that. We did have 28 cases that were positive over the last week since last Tuesday, but there were 0 cases reported yesterday and today.
Next question from Mr. Chris Larson. Go ahead, Chris.
Thanks, Ken. Question is for Senator Cramer. Senator Cramer, a lot of talk, and Kelly, you can answer this too, a lot of talk from Seema Verma yesterday with regards to relaxing some of the requirements and regulations for long-term care facilities. One thing that hasn't been addressed yet, visitations. From what you have heard, Senator and Representative Armstrong, where is the administration on that right now?
Well, Chris, I got most of that, but the last couple of sentences you said, you talked about long-term care facilities, but what was
yes, long-term care facilities. Where is the administration in regards to opening up long-term care facilities for visitation?
Sure. So okay. I just want to make sure I got that right. So I talked to Administrator Verma on Friday of last week, and she told me that she was looking to do a new guidance on Monday, which they did do late yesterday. She announced new guidance as it relates to opening up long-term care facilities, nursing homes for visitation. Now, and I love Seema Verma. I think she does a great job, and we know that, of course, our nursing homes are home to the most vulnerable population to this disease. And we know where the big breakouts have been. In fact, I think something like 40% of the deaths from this disease have occurred in nursing homes. But I don't. That probably wouldn't be real surprising, I guess, when you think about statistically what who the vulnerable population is. But nonetheless, there have been policies around the country that have not only have they not protected nursing home residents very well, they've done just the opposite. And so I think in North Dakota we've done a good job of protecting that population. Unfortunately, one of the consequences of that, of course, is that to keep the disease out, you have to keep people from the outside out. My mother happens to be in a facility in Fargo where they've had quite a number of people. Now they've only had 2 deaths. It's too many, but there've been a lot of people that have tested positive, but most of them are employees. And those employees, of course, are more likely bringing it in than they are taking it out. All of that said, with what we have today in terms of greater access to PPEs, greater access to testing, Administrator Verma, in their guidance last night, is setting the stage for allowing states and local communities to open up nursing homes to visitors. Now, with that comes some guidance. And if I read it right, Chris, and this is sort of my read on it, I'm certainly not the expert. And the criteria for doing all of this, of course, really rests with states and local communities, and in many cases, the facilities themselves. CMS does not mandate anything. However, no secret that the Centers for, and CMS, for people that may not know, is the Center for Medicare and Medicaid Services. They do provide distribute the funding largely through Medicaid mainly and as well as Medicare. And so when you're the payer, you have a lot to say about the policies, and they do have criteria that they want, they expect to be followed to keep their residents safe. That said, the guidance from yesterday does start the process. And my read of it is that somewhere, as you approach that, what's considered the third phase in the restart, if you will, somewhere around the third phase, you'd be eligible to open up, but it does require some good benchmark testing. I think most of the facilities now, and Mayor, you might know this, most of the facilities have done benchmark testing of all staff and all residents. And then being able to, obviously, you have to have sort of that ongoing, because every day is a new day and every person you come in contact with is a new person. But she did, like I said, she did announce late yesterday that we can start the process toward phase 3 of reopening for visitation.
Yeah. Thank you, Senator Kramer. Representative Armstrong.
Yeah, and I would just add on to that. I mean, I think it's really important to recognize, one, that we get some, the local decision making in that, but two, also that what Senator Kramer said, that is truly our vulnerable population. So as we continue, there's been a lot of talk. I know there's at least one mayor at one city in this country that said they're not going to reopen until we have a cure or a vaccine. That was never intended. That was never what the intent of this was. The intent was to be able to build the capacity to deal with this in a normal fashion. But also, as we continue to do that, whether it's North Dakota Smart Restart or anything, we want to protect those people. So that could change, but even once we get to that third stage, that could change community to community in a real quick hurry. We know North Dakota has some of the best broadband in the country. We've been talking to the AARP and some different people about scaling up the capacity for Wi-Fi, and it's something as simple as 5 iPads to be able to utilize in those types of situations as well. And have been talking about that, because that is something that, even continuing moving forward, in the grand scheme of how the federal government spends money, that's a pretty low cost solution. And you got enough Wi-Fi capacity internally within these homes and the ability to do video calls. I know that's not a perfect answer, but it is in some of these places. It's just they haven't even had that ability to do that. So being able to do that when we do have these fires that have to get put out in these different communities across the country, because you can also know this, if there is a big a clustered outbreak in a particular community, one of the first places that's going to go on lockdown, so to speak, is going to be the elder care facility or those types of places, because of the vulnerable nature of their population. So we want to be able to get towards that, but we also want to utilize technology in this way to be able to do it as much as possible.
Thank you, Representative. Next question from KNOX.
Heard about various next level responses for Senator Kramer, in case I didn't get caught, regarding what will happen as far as PPP loans, as far as more stimulus money, as far as the extension of the extra $600 benefit for unemployment. Some of that was grouped together in a big bill that was sent over to the Senate. May have been political implications, may not have been. What's the Senate's thoughts? What are the thoughts of your colleagues as far as what the next monetary response from Congress is for COVID-19?
Yeah, well, yeah, great question. And that's sort of the main question around town here. Every gaggle that I stop at, the press gaggle that I stop at, which is a couple a day, that's kind of the main question. So, in fact, today the president at lunch very specifically stated, he said he thinks the Senate Republicans are sort of doing it the right way. Let's get through this week. Next week is Memorial Day week, so that Congress won't be in session next week. And then when we come back, take a look at where we are at the time. Kelly referenced it earlier, Representative Armstrong referenced it earlier, and that is to try to keep some flexibility. He made a really important point, which I appreciate him raising, the warp speed at which both the Congress and the bureaucracy has created and then administered these programs. Part of that's been a little frustrating, because, of course, some of the rules have been being adjusted on the fly, but that's because they're responding to what people are saying. And we've been particularly blessed to be able to, be on the right committees, represent people who are very engaged, have stakeholder groups, like Kelly said, community bankers and whatnot, that are having their input, and as a result, we're getting it in. I've had as many as 3 calls a day from 3 different cabinet secretaries to talk to them about a specific case with a specific stakeholder. Might have been a city, might have been a county, might have been an individual. And so literally the dynamics, as Kelly called it, really been remarkable to watch. It's actually kind of encouraging in a way, although most things require more thought than a crisis, hopefully. However, with regard to the next phase, that's why we still, say, Paycheck Protection, for example, in North Dakota, I think over 80% of the eligible workforce has been covered by Paycheck Protection. Now we're looking at loosening the rules a little bit. There's still, I think, $100 billion that has not yet been lent from the phase 2 part of it. So there's, that's sort of slowed down the demand for that. But there's another, $1 trillion or so in Treasury funds that are to be leveraged with credit tools at Federal Reserve that are still being rolled out. The next phase, of course, was the Main Street Lending Program, which was for employers up to 10,000. And that one had a little bit of a clumsy rollout, and then it made some adjustments with an expanded program. But there's still a pretty big gap for mid to large companies, mid-sized to large companies that were creditworthy before COVID-19, but they're not investment grade, and they tend to sort of fall through the cracks. You would have been happy to loan them money, in February, and a lot of them are in North Dakota, frankly. But now they're not. They're not bankable, if you will, because they're highly leveraged companies. There's just a lot of that stuff that's just starting to roll out. Not even final rules yet, but over the next days and weeks. So we really haven't seen how that's going to play in into the economy and how that will affect things. The mayor, I think, made the point early on that I really appreciated, and that is, nothing. All the money in the world isn't going to do a lot. He didn't say it this way. I don't want to put him in the spot, but all the money in the world is not going to matter until the economy's reopened. So what I do think we need to do, though, is we need to look for ways to make sure people can pay their rent, make their mortgage payment, the things that actually they're fundamental to the economy, to everybody's economy. There's a lot of times we can talk about billions and trillions of dollars that might help, the stock market. And I don't want to diminish the importance of things like that. However, what we really need to focus on, in my view, in the next package is what helps the economy. And by economy, I mean the individual's economy, the family's economy, the small businesses' economy. And that's going to be reopening. As much as anything, it's reopening it so that people can, first of all, get to work, and that people can shop, that people can start spending money on the things that they want to spend money on. And then I think you're going to see that bounce back much higher than if we just put a whole bunch of money into some sort of credit facilities and provide a lot of liquidity for the markets. But we do need to provide liquidity for like retailers, for restaurants, and and others that, while we've been able to cover through the Paycheck Protection Program their payroll, that doesn't really help the owner of the place pay their rent, doesn't help them pay. I mean, it can be used for some of that, but it's still, at some point, they have to make money with their customers. And so, we just need to get things reopened up. And then I think we can take a look at a next round. With regard to unemployment insurance, one of the things we don't want to do ever again, and we tried to change this before the CARES Act passed, we tried to do it in negotiation. We tried to do it on the floor the day that we passed the bill, but we failed in the amendment process. And we can't continue to provide a greater incentive to not work than to work. Certainly, plussing up unemployment insurance, extending it for people that have to be unemployed because their place of work isn't open is one thing. But they should be able to make more money not working than working, because it just creates a perverse incentive that works against us. So we certainly, in the next tranche, have to take care of that.
Yeah, and I would just add one thing to that. This package that we sent over, and I use the term "we" pretty loosely, extended that $600 unemployment till January 31st of 2021 without any caveats. Now, I come from an area where there are going to be people whose jobs no longer exist. And I think it's important to recognize, in order to have a good job, you have to have a good business to work for. And that's what North Dakota is built on, is small businesses. But at the same time, the political dynamics are different in every community across this country. And if that unemployment insurance is just blanketed out with no guardrails until January 31st of 2021, that is exactly what Senator Cramer is just talking about. There is no government program that can subsidize 100% of lost business. And if local mayors, and we're not incentivizing to do smart restarts and do these things, then we are going to see temporary furloughed employees become permanently unemployed in a really quick hurry. So I agree. We need to take care of the people who need it, but it can't be a blanket, no guardrails, just extended all the way until the end of January next year, because that will not help solve the problem.
Thank you, Representative. We're going a little bit long here, but we'll take two more. Next one from Neil Carlson.
Deb Swanson again. This question in part. There.
Go ahead, Neil.
Deb Swanson again. This question, apart from a viewer, Governor Burgum has indicated he's trying to do a total test of all the nursing homes across the state, and it appears that maybe, well, I guess we won't name specific ones out in western North Dakota. There are some of them now that are declining to do that. Do you have any legal mandate, at least in Grand Forks County, if you see a cluster, to walk in and go, well, we're going to test everyone at this company or organization?
Grand Forks Public Health Department doesn't have a specific mandate over nursing homes. They are regulated by the state health department. But I will say this, the information that I have about nursing home testing is that it's been offered everywhere. There were a few that declined it, but I think it was because they declined it at the specific time it was offered, but then rescheduled it. So a lot of it has to do with their capacity to carry it out. And then I know there was one that was canceled due to lab capacity, but that one was rescheduled. If there are others that have not had the opportunity to take advantage of the testing, I'm not aware of that. What I do know about is Grand Forks County and all of our long-term care facilities here have embraced the opportunities. They've needed little assistance to do it. They've been very vigilant about it, and all of their results are reported on the North Dakota Department of Health website.
Thank you, Deb. And our final question from Mr. Joe Bowen.
Hey there, this is a reader question, or at least a question from somebody on Facebook here. What's the plan if there's a spike or a rise in cases later this summer, like say in August or September?
I'm going to direct this one first to Director Swanson.
I want to add a comment to that question, and the comment is because we have our federal representatives here, I want to take advantage of the opportunity to thank them for the funding that's come through the CARES Act that actually is filtering down to the local level, to Grand Forks Public Health Department, indeed. Public health is on the front line, and we are the ones that have responded from the very beginning of this pandemic. So the funding will be very well used, and it will cover the entire state of North Dakota because it's largely delivered at the county level. But with respect to your question, we like our data in public health. Unfortunately, testing data lags a little bit in terms of what's really happening out there. And we also know that we have asymptomatic carriage of this particular virus. So we're going to be watching the information very closely. We do want to help increase testing. We do want to make sure the most vulnerable people in our service area are protected. That includes long-term care. It includes a lot of other vulnerable individuals as well. So we're going to be working very hard to continue all of our prevention messaging. That includes when businesses do open, they need to really be following the guidance to protect their employees and protect their patrons. So those are the things we will be doing in public health. And I can't predict the future, what will happen, but we will certainly be monitoring the situation every day, just as we are doing now, and we will respond to whatever actions we think might need to be taken, whether it's on a local level, following state guidance, or following any particular federal guidance that we get from the Centers for Disease Control.
I would agree.
Thank you, Deb Swanson, and thank you for members of the media for joining us here this afternoon. We're going to wrap this up. Now, we've normally ended these with Mayor Brown having the final word, and we will do that again. But since we have our federal delegation here, Senator Kramer, Representative Armstrong, any final word you'd like to give to the Grand Forks community?
Well, the one thing that I would say, and thank you for the opportunity, and thank you, Mr. Mayor, for doing this. I know it's a great service to people there. And one thing that's the most helpful thing in a time like this is good information. So thanks for providing us this forum and for doing this. And to Deborah, you're right. I mean, public health is really on the front lines in so many of these communities. And one of the things I probably should have said earlier, and it's not a bad time to talk about because the most recent question raises the point too, and that is, whatever happens in the future, the one thing that there is complete bipartisan support on, and that is we always have to be, as a Congress, nimble and ready to provide whatever resources are necessary to fight the disease itself and to fight its spread. And so, even if there's not another stimulus package, there needs to be assistance ready to go to our healthcare facilities, and whether it's from the state level to the community level, and obviously to all of our systems. So that's one thing. Second thing is, you make the point perfectly as to what Kelly and I are talking about, to confirm what Kelly and I are talking about. And that is, the main thing is that we remain as flexible as possible. And that's why the resources have to be as local as possible, because she makes the point to your question, what if? The what if? Well, the people most able to deal with the what if are the local folks. And they can only do that if they have good information. And the lag, for example, from testing is good information, but sometimes, time is also important. So I would just congratulate the mayor and the county and all of you for being diligent, for being connected. Thank you for being accessible to us as we try to shape public policy that is helpful to the people that we all work for. So as always, the door is always open and the phone line is always open, and call whenever we can be helpful. In the meantime, stay safe. But don't, my last admonition is, but please don't trade in living for surviving. I worry a little bit about that fear has a paralysis about it. And, we can both, live with great joy and great connectivity and great activism, and maybe even some baseball, Kelly, but also be safe. Thank you.
We need baseball. My wife's a little sick of me watching classic Major League games from 1995, our 91 Twins, 87 Twins on TV, 86 Mets. But I agree with that. And I think one of the really, truly false narratives that has come out of this whole thing is you're trying to base health versus the economy. And that has just really been disheartening to me, because that's not the argument. The argument is health and our society. People need to be able to interact. I have a 12-year-old and a 10-year-old at home, and I can tell you, outside of failing as a homeschool parent and have more appreciation for our teachers from one end of the state to the other, but I have two very well-adjusted, great kids, and this is wearing on them as well. We need to be able to have our societal interactions. And I think it's also, this goes to that last question too, is when we have flare-ups, one thing we have is the capacity. 2, we have a governor who understands data as well as anybody. 3, both our largest communities in the Red River Valley have mayors that are doctors. I feel like you all are much better able to deal with these things, provided you have the resources available, than any politician in DC. It doesn't matter if they're Democrat or Republican, particularly as different areas go through their peaks at different times. So we've built up the capacity. We still don't know enough, but we know more about this virus than we did 2 months ago. And we have just a societal and community relationship with each other to deal with it. So that's how we deal with those things. That's how we keep moving forward. And that's how we don't lose our society in the process as well. So thank you, Mayor Brown, for having us. It's always great to talk to you, Senator Kramer. I think we're ships passing in the night back and forth to DC. Although I'm not sure we're going back ever again. So.
Very empty ships, though.
Thank you, Senator Kramer and Congressman Armstrong, for taking times out of your busy schedules and joining us today. And thank you for all your hard work on our behalf. Working effectively across federal, state, and local government will be critical moving forward, and Grand Forks and North Dakota can be assured we have good teams at all levels in place working together effectively. Remember to keep up the physical distancing measures and follow the guidelines set by the CDC and by the state of North Dakota. Stay vigilant, stay cautious, slow the spread, and save lives. We're in this together, we'll get through this together, and together we will emerge stronger. Thank you.